It's your eye health experts, Prevent Blindness Texas, and welcome to Eyespiring, a conversation about all things vision and life.
Welcome to Eyespiring Podcast with Prevent Blindness Texas. I'm your host, Heather Patrick, the CEO of Prevent Blindness Texas. Prevent Blindness Texas is focused on advocating for improved health equity, empowering children, adults, and seniors to experience life at the highest level, and improving overall health, including physical and mental health, by preventing vision loss and addressing eye health issues across the entire health spectrum. Our work improves the health and quality of life for thousands of individuals across the great state of Texas. Um, I have been doing this work for a long time, and love the work we do. I believe in advocating for improved access, improved health education, and just connecting people to the care and information they need. It's a great space to be in, lots of exciting things happening. And today we're going to talk to Jill Ames and just get a little different perspective about the space. And so, with that, I'm going to introduce Jill. Jill is the manager for the Alcon Foundation. She's a seasoned social impact professional with over a decade of experience in strategic charitable giving and partnership development. As manager of the Alcon Foundation, she leads development and implementation of Alcon's charitable giving strategies, contributing to Alcon's reputation as a global leader in eye care. She is passionate about building and supporting collaborative programs that improve lives by ensuring individuals in need receive the eye care they deserve, fostering healthier, more empowered communities. And I will say, I have worked with Jill since I have been here. It's an amazing partnership. She's an incredible individual. And it's really been fun to go on this journey together and watch things happen and change and evolve. But I will say you are one of the most collaborative partners I have worked with. And it is a lot of fun to do this with you and take this journey. And Alcon's been an incredible partner. But I'm a big believer people make the difference, and you definitely have for us. So tell us a little bit about yourself, and then we're going to dive in.
Absolutely. Thank you, Heather, for that introduction. And yeah, I agree. I love collaborating with you all. It has been a really great journey over the years to just get to know Prevent Blindness Texas better, to see how we can collaborate to, continue to make an impact on, the patients here in Texas. And, I think one of the coolest things that I've seen just over, the time of our partnership is just how things, I think from our perspective, watching Prevent Blindness Texas grow, and really get it, kind of sink your teeth into, the data and analytics and positioning ourselves in a place where we can really know what's happening so that we can then, really help address what the gaps are. So it's been really cool, kind of watching that progression over the years. But yeah, I'll share a little bit about myself, just an introduction. I've been with Alcon for close to 15 years now. I started in September of 2010. And I actually started in our customer service department. Prior to that, I was in banking, which
Really?
yes, I was. It was. I went out of college. I have a degree in communications, and after college, I was like, okay, I just need a job anywhere at this point. We'll be fine. And I ended up going into banking. I was a teller and then a teller manager for a while, and really enjoyed, working with employees and kind of getting to know what makes them tick and what they care about, and of course, both from a personal and a professional development perspective. And it was very much a customer service oriented role. That's what I've done since I was 16. And so I've always just really loved helping people. And, working at the bank, I was able to interact with people every day. But frankly, I got burned out. I was really looking for something that I felt had more of an impact, had more of a purpose to it. And I will share, my mom actually worked at Alcon for 30 plus years. And so when I started feeling like my time at the bank was coming to an end, I was talking with my mom almost daily of, how can I get in at Alcon? Are there any openings? Do you know anybody? Can you put in a good word for me? So I ended up getting over at Alcon in the customer service group. And I did that for about a year. And then just when I first started at Alcon, I came to learn about Alcon's charitable giving, and I had no idea that corporations even gave charitably. When I first joined, so it was new information for me to learn about how companies are giving back, and so I remember learning that in my orientation, and then was doing my customer service thing for a while, but then a role came open in our corporate giving group, specifically supporting our patient assistance program.
Yeah.
And I thought, what a cool opportunity to
Yeah.
take my skills in customer service, my passion and desire to help people, and really get to talk with patients that are in need. And so this program, for to be specific, it's for patients who cannot afford their medications that have been prescribed, their Alcon medications that have been prescribed. So being able to get those patients the medications that they need at no cost, I was like, okay, I'm sold. This is exactly what I want to do. And I was able to get the role.
Mhm.
It's a very popular role at Alcon. I'm sure at other companies as well, to be able to work and do the work that we get to do. But I'm very blessed to have been able to get into the group. And so I did the patient assistance role for about 6 months, and then I was asked to move over to support the foundation, which frankly terrified me because I knew nothing about charitable grant making. I frankly didn't really quite understand what the foundation did exactly, except I knew they did really cool things to support nonprofits. And so I moved over to support the foundation, and that's when I started working with Rhonda Bryant, who has taught me pretty much everything I know as far as charitable giving goes, and really learning about my my elevator pitch is always like, I get to give the company's money away. And people are like,
You
oh,
invest the company's money.
exactly. Yes. And I'm like, there's way more to it.
Yep.
It
Yep.
has to be very strategic. We have
Yep.
to make sure that we're being good stewards of, the resources that we have that Alcon, gives us. And so it's a very it's really amazing work that we get to do. And really it's all about the partners for me. And it's
Mhm.
about the patients, that we help to support.
Very cool. So tell us a little bit about Alcon. So for anybody that's listening that may not know, tell us a little bit about who
Absolutely.
Alcon is and what they do.
Sure. So Alcon is eye care company, medical device, and moving back into pharmaceutical space. We have been around for roughly 80 years. First started here in Fort Worth, Texas, where I'm based. It was actually two pharmacists, Alexander and Connor. So that's where you get the Al and the Con
Mhm.
from.
Oh,
And we are now, grown into a global company. I think we have probably roughly 45,000 associates across the globe. And so, yeah, it's really great working for a company that I think, really does have a noble purpose. It's,
mhm.
and I think that is something that I have seen many companies doing, over the last several years, is kind of tying what they do back to a broader, bigger purpose, right? And come work for us because, you get to help in this way. And to me, eye care has always just naturally been that, that you don't have to really push hard or try to sell, the fact that what we do as a company is, helping people either returning their sight, restoring their sight, enhancing it, which is great, just at face value, of course. When you talk about, yes, people need to be able to see, but when we really get down into the impact that that makes, and I'm sure we can talk more about it, but it just goes so much farther beyond, oh, this patient now can see their grandchild for the first time, which is amazing, right? But it's
Yeah.
also, this patient can now return to work and make
Right.
a living and support their family. Or this
Yeah.
child is now seeing in the classroom better and doing better in the classroom. So it really is like pulling that thread through, to show that, what we do as a company is very important, but also it lends itself really naturally, I think, to the charitable space that we work in.
Absolutely. To me, vision is kind of the fabric, right? It is the fabric of our lives. And probably because I'm in this space, so I might just be biased, but I really do think, and we talk about this often, just how deep it is truly into our families, our communities, And I think because a lot of people just take it for granted that they don't really um, take a step back just to see how important vision is. We were talking to one of our partners last week. She is with one of the school districts we support, and she actually shared with us that she had not gone to get an eye exam until she started to work with us.
Mm,
And I was like, oh, Sabrina, we got to tell that story. And she's like, now I really understand why it's so important. And beyond just, being able to see, but all the health components. And I was like, that's why we do this work. That's
yeah.
why we do it. So it was really a cool experience.
Hmm.
Oh, now Alcon, in terms of kind of culture, really kind of walks the walk. Right. So they don't just talk it, they don't just invest, their employees get really involved too. So talk just a little bit about that.
Sure, absolutely. And honestly, that is one of the things that, as I shared, my mom worked at Alcon for
Mhm.
30
I
years,
didn't
and
know that. That's
yeah, and well,
that's
so
really cool.
I have some cooler stories that I think you'll get jazzed about. So I remember as a kid, this, and I think this really blends nicely to the question you asked. As a kid, I recall going to different volunteer events that my mom was doing with Alcon
Mhm.
to help. Junior achievement, I recall. I know that they used to do different things with United Way, and my mom was a single mom, so she, if my sister and I happened to not be in school that day, we would get to go and volunteer, which happened a few times. I also remember as a kid participating in like the Night for Sight that
Oh,
PB
yeah.
Texas used to
Yep.
do on
Yep.
Alcon's campus
Yep.
years and years ago.
Yep.
So that was really my first, exposure, I think, to obviously to Alcon and
Right.
Prevent Blindness Texas. But um, that I think right there goes to show it is very much in our DNA as a company
Mhm.
to want to support the communities that we
Mhm.
operate in. We have thousands of associates who are so passionate about many different things. Eye care obviously is one of those. And I would say over the years, probably I think the coolest thing I've seen, and it has morphed and evolved over the last decade or so, is the fact that in the state of Texas, especially, the fact that associates can be trained to be certified vision screeners and then partner and we love the fact that you guys help us with that and help us get our associates trained up so that they can do those screenings and do them well and make sure they're not missing anything. But it really that the fact that we've had these associates that can get trained, be certified, and then go help the school nurses with screenings or even volunteer on their own time in the community or at their kids school or whatever they may choose to do. It is such an awesome tie back to what we do as a company. And then as the years have progressed, we've kind of grown and morphed that program. Because we know how important it is, as you all do. You don't stop at the screening. You are then walking that patient through the system and helping them get plugged into whatever resources are available to them. Whether they have insurance and can go, see an eye care professional or they don't, and we can help them, get them connected to community resources. So that I think is another evolution that I've seen with Prevent Blindness Texas over the years is, and a lot of organizations really trying to go beyond, here's your voucher for a pair of glasses. You've gotten your
Yeah.
screening and now you can go, hopefully find some care, but really staying with that patient and that case management and really um, almost individualizing and customizing, that care, for that family, for that child. So, and to me, that that is where the impact is making sure that they get into that care and receive, all of the care that they need to have that bigger impact.
Yeah, right. It's creating that pathway and walking alongside them, right? Because for me, and we've talked about this too, right? We can screen all day long and we should, but if we don't have a place for them, if we can't help them go where they need to go, if they need treatment, then I I mean, we put them in a really hard place. And so I think it's our obligation to do what we can do to help them as much as possible walk that path together. I mean, it's not possible for every client, but certainly a majority of them. That's what the team does is really that care coordination of working with parents and teachers and schools and nurses. and really helping them close the gap and understand how important is that that pair of glasses can change everything for that child. And I really think that that's the comprehensive approach. And I think that definitely, over the last 8 years, that approach for PBT has really changed. And so I'm proud of that. But we couldn't do it without partners like you, and not just the funding, right? I really appreciate it. It is the partnership. It is the ability to come to the table, bounce ideas off of each other. Not everybody has a funder like that. Not everybody has partners like that. But I really, I you set the mold in that sense of you're just great partners to sit down and brainstorm with. And some things come to fruition, some things don't. But it's just such uh, an honor and privilege really to be able to have that kind of relationship. So I value it so much because it has been so helpful over the years to really help push us think about different ways to do the work, different partners that we hadn't thought of. So it's a great relationship.
Thank you. We feel the exact same way, and it's that is part of what makes, I think, this role so unique is, oftentimes I think people, it's mischaracterized a little bit as, oh, it must be such a fun role. Yes, it's fun, but it's also very hard, and takes a lot of work. And then I think, other times some thoughts are, oh, well, you're just cutting a check, and that's it. But that really is what you talked about, that partnership, that collaboration. Even if it's something just as simple as we have, a partner here that's working somewhere and a partner that's working maybe somewhere similar. Hey, have you guys met? Making those, facilitating those connections and having those just brainstorming conversations and getting jazzed and creative and excited. That's what makes this work, so much fun, really. And that's where all of the ideas were born. And like you said, even if it's not something that comes to fruition today, there have been conversations we've had where years later things are kind of starting to, it's planting that seed. And so it's really cool to watch those kind of things unfold, years later sometimes.
Yeah. Yeah. Okay, so we talked a little. I thought your first connection with PBT was me. So I love the fact that you did it as a kid and that your mom was there. And that's so full circle. That's really cool. Why is health so important to you? Besides the fact that you work in it, right? But I still think we're drawn to these places that we have these connections to. So why is eye health important to you?
Really good question. And to be very honest, when I was looking to escape the banking industry,
Which I still can't believe you were in. I can totally see you doing customer service. That totally aligns. But now knowing you, I can't see you in the banking industry.
it wasn't, I'm getting out of college and just trying to get
Yeah,
a
yeah.
job,
I mean, it's a great
and
industry. It's a
it
fantastic
is, oh yeah,
industry.
yeah, but it just was, it was not for me.
Yeah.
And so, yeah, I honestly I myself didn't realize the importance and impact of eye care. Even when I started at Alcon, this is a great employer in my community. My mom's worked here,
Yeah.
and I think it's a great place to work. But I mean, as soon as you get onboarded, you kind of become, a champion for eye care. And I feel, really, really lucky and fortunate to be in the role I'm in, because I get to see, obviously, the commercial and business aspects of it, working at a large company, but seeing the more humanitarian side of it. And we make fantastic products, fantastic, pieces of equipment. And that's great, but the human side, right? The people that it's helping, and getting to have the connections and really seeing the impact that it can make, again, whether it's partners sharing pictures and videos with us, or visiting a partner site and seeing programs that they're running, and seeing people just, with a cataract surgery, for example, and having that bandage come off and be in tears and just be unbelievably grateful. And I mean, that right there is bigger than me. That's bigger
Yeah.
than us. That
Yeah.
there's something
Yeah.
bigger to
Yeah.
that. And for me, I need something like that, in my personal life, in my professional life. It's just, part of who I am.
Mhm.
And so having the ability to see what eye care does for people, what access to eye care does, a pair of glasses, a 10-minute surgery, that absolutely changes people's lives. I mean, all the way from being safer on the roads to be able to
Mhm.
drive to, again, returning to work, to learning, to, just all of the things. And then I think about if that one person now can see and the impact that they have on other people's lives
Yeah.
and that
Yeah.
ripple effect,
Yeah.
that to me is what makes eye care. It's like that's bigger than just that one patient getting services. And so that's kind of what gets me really excited and jazzed is the ripple effects of it.
Me too. Me too. Okay, so you're clearly passionate about the people, collaboration, inspiring work. Who inspires you?
Mm.
What inspires you? Because this work is hard.
Oh yeah.
Um, I think to your point, a lot of people think, oh, you're a funder, it's easy. But I've been on that side and it's not easy. Um, and so tell me what makes the hard days, what keeps you going?
People like you, honestly.
Oh,
It's our partners.
mm,
I am constantly just in awe of our nonprofit partners' abilities to like respond quickly, pivot quickly, make changes. And I mean, during COVID, especially, it just has, and even now, with all of the uncertainty,
yeah.
watching our partners, even with all of the difficulty and all of the challenges, just keep pushing, just keep, because it's like this I don't know what it is. It's like this innate thing. I feel like in a lot of our partners that
Mhm.
are in this space, you
Yeah.
know, just have this passion that this fire that won't die.
Mm,
And it's all to help other people. And so talking with our partners and getting to hear stories about different patients that have been helped or even eye care professionals and their experiences in under resourced areas and hearing how it changed their lives of being able
mhm.
to train other eye care professionals and help patients that maybe travel for days to get to the site that they're, doing the work. So it really is, it's being connected to our partners. When we're having a rough day at work and we're having to, deal with all the corporate stuff that happens at corporate
Yeah.
corporate places, when we have a partner call, that is absolutely when it's like, okay, this is the reminder of the why. This is why we do what we do. We are helping these patients return to their lives, and improve even, more so than where they were before.
That's awesome. Yeah, my leadership team met this morning and we what I think is so incredible and I think my team has done it so well over the years is okay, we're just gonna problem solve. We're just gonna figure it out. We're you throw this barrier up, okay, we'll figure it out. And I think that is um, I think it's a testament to the nonprofit space, but I really do. There is something about the vision space and the organizations in the vision space in particular. And okay, we'll figure it out. We're just like, we are committed to solving the problems. And I think there's this hope, right, at least in there. And I think that for me is kind of the pushing factor too, because it can be solved, right? I mean, that's why I get so excited about this work and the things we talk about, and because it can be solved. It's still solvable. Now, 10 years from now, if we don't do anything different, that may be a different story, right? But right now, with just doing a couple things differently on a large scale, it is solvable. And I think
Right.
that is what keeps us coming back to the table too, is right. We can do this. We can still make a big difference. You know.
Absolutely.
So so you answered this a little bit, but I want to talk more about it. So one of the questions is, were you always interested in the philanthropic field? So I sort of, right? You didn't necessarily know you were, right? But you got in. Okay, so now you're at the foundation. So what was kind of the most surprising when you came into the foundation and had to learn that part of the business? What kind of stood out to you?
Absolutely. I would say it's the depth um, with which we get to know our partners.
Mhm.
And I had no idea about essentially that partnership management, relationship management. I mean, I guess I knew a little bit about it from my customer service days, and but yeah, just the time that it takes, and um, the commitment that it takes to really get to know our partners, because you can't, I have found that if I am not really plugged in and having conversations, frequent touch points, really staying plugged into how our partners are doing, what they're doing, gaps that there may be, how we can help continue to support, broaden our support. It isn't like a one and done. As it is ongoing, and things change and evolve. And so we're constantly having to stay in touch, and really just keep those relationships deep. And there's a lot of reasons for that. It helps me do my job better. I can't figure out how we can help you all if I don't know exactly what you're doing, how you do it. And so that honestly has fulfilled kind of this nerdiness in me, because I love learning. I love just getting to know the nonprofits and how they do what they do, and all that it takes, all the technical stuff, and and the impact that you all are making. And once I know and understand that, I can then take that information and kind of evangelize it right to our leaders and our board. And it's that's how I see my role is, I'm there to speak on your behalf and advocate for you, and say this is why we need to support this work. But I can't do that unless I'm really in it, which again, I love. It takes a lot of time. And I think that there's a lot of, I think it could maybe be, that's something maybe people don't know about, kind of like grants managers, or, this type of work, is you really do have to, there's a lot of analysis. I do a lot of reading, I do a lot of research, because I can't, one of the things that I have to do to make sure that I am working with integrity is I can speak to what this organization is doing. I feel proud and good to represent them to our board and leaders. And so that takes a lot of time and effort to do that, but I absolutely love it.
Yeah, because basically you're going to advocate on to what to invest in, right? And so really, in order to be effective, right, from a funder perspective, it really is kind of looking at risk, right? And in order to really assess risk, you really have to know an organization, right? And if you're going to advocate for investing in them, you have to know why, right?
Yeah,
Why. So
absolutely.
if you were going to tell, so for those that are listening, if you were going to give them like two pieces of advice because they want to get into, working for a foundation, any corporate foundation, larger foundation, what would you tell them? What would be the two things you would tell them?
I would say be ready for change, because it's
Mhm.
constant. And I would say, especially if you're getting into kind of the corporate social impact space, um, be ready to face challenges, be ready to argue the importance of the work that you do, and be ready to tie it back to what the company does as a business, which again, for us, comes so naturally, when
Mhm.
we are kind of shaping our strategy, which has, remained largely, fairly the same over the last several years, primarily focused on eye care. That's what we do as a company. And it's an interesting balance, because, being a charitable foundation ourselves, we do, and working, within a pharmaceutical med device company, there are many regulations and rules and things that we have to be mindful of. And so, the work that we do is the decision making process that we have is separate and apart from our business structure. But we do have to make sure that what we are doing runs parallel with who we are as a business and what we do as a company.
Yeah.
And that right there, strengthens when we're going to our board and saying, hey, let's invest in these programs. And they say, well, why? We can then tie it back and say, because this is aligned with what we do as a company. That's not why we give. We give because it's just in our DNA. It's what
Mhm.
we've always done. It's the right thing to do. We know that it elevates everyone. But we also know that in order for us to be able to continue to do the work that we do and grow, we do have to tie it back and help our leaders understand the importance of it, right? And essentially how it's helping us as a business, reputationally or whatever. So those are the pieces of advice is, really you do, even though for us it is a bit separate, we do have to be very much aware of how the business is doing, what the priorities are, to make sure that we are still kind of in lockstep, with who we are as a company.
Yep, strategic alignment. How to
Absolutely.
advocate for strategic alignment.
Yes.
Yep. So let's switch a little bit. So, what are still in the same realm, but what challenges do you face as a foundation, and kind of in the space, but then just as a larger investor into the community? What do you see, especially over the last, you know, 15, 18 months, and certainly even moving forward? What are some of those challenges? What do they look like for you?
Absolutely. Um, Gosh, challenges. I don't want to harp on challenges. I'm like, oh, how do I pick one? Um, which sounds terrible. I would say, obviously, the environment that we're in right now, potential changing policies, rules, regulations, things like that. A lot of our nonprofit partners are, in a position where it's like, oh, what's going to happen? We're, a little scared, which is completely understandable. And so, what we're really doing is just we're really trying to be more intentional about staying in touch with our partners and just having conversations. How are you doing? How are things going? What is it looking like for you? If we do support, say, for example, if we have made a recent donation, do we need to look at reallocating perhaps
Yeah.
because funds have been taken away elsewhere and whatnot? So, we are just kind of keeping an eye on things, and really just keeping in touch with our partners to see how can we, help, if there's certain programmatic areas that, maybe have been affected, how can we help redirect and support?
Mhm.
But, really overall, for us, I would say it is oftentimes we're having to make the case for why we do what we do,
Mhm.
and continue to get support, internally from the business. And, we have seen tremendous growth, as we as a company spun off, in 2019 as an independent publicly traded company. We really have, really magnified how we talk about ourselves, externally. There's a lot more stories out there about Alcon. And so with that, it kind of increased visibility comes increased requests, increased
Yeah.
asks to
Yeah.
us to support
Yeah.
amazing, partners and programs. And so it's a challenge trying to kind of deal with the headwinds and acknowledge those, but also try to make the case to our board of, hey, here's why we have an opportunity here to maybe get some more resources to grow our support of some of these partners, because we know that there's these challenges that are coming up. And so that is kind of a constant, gentle push of,
Yeah.
how can we do more? And so that's always a conversation that we have. And again, it's finding that balance too of talking about what we do, but in making sure that it's done with integrity, making sure that it's, done tastefully, that we are, highlighting our partners and the patients that are served. And, but doing it in a way that's balanced so that we aren't getting more requests in than we can actually support,
Yeah.
right? We want to
Yeah.
talk about the partners that we support and the patients that you all serve, and share that story because it's important to share. It raises awareness and it oftentimes helps our partners, get more support
Yeah.
and recognition. But finding the balance there so that we're not screaming from the rooftops about everything that we do, but then having to turn around and say no to additional requests that we get, that can actually that probably is the biggest, I would say, challenge that we continue to face.
Yeah. And that's the hard part of the job too, right? There are amazing, amazing organizations to invest in. And likely you probably always have more requests than what you're able to invest in. And it's hard because sometimes you want to do them all.
Yes.
And so I mean, that was the stress behind when I was in a funding role, being able to really invest strategically, um, right, make those decisions, build those partnerships. But it is hard when there's just not enough money to fund all the different pieces because there just are some really great organizations out there.
Yes.
So,
Yeah, absolutely. And also making sure that, we're being consistent in what we're
yeah,
doing and
yeah,
how we support. That's always been a big piece. And now, I will say too, one of the biggest things that I'm seeing kind of on the horizon and well, it's actually here is a push with large companies to obviously engage associates, but beyond volunteerism.
Mm.
And so I'm seeing a lot kind of in the social impact space about more kind of democratized grant making, right? So involving associates in grant making decisions in some way, so
Mm.
that is something that I'm seeing kind of come up to, I think, the forefront is as companies really want to leverage their employee,
Mhm.
work
Mhm.
base and
Mhm.
get them involved in causes that matter to them, volunteer wise, financially,
Yeah.
whatever that means. Um, we're seeing an increase in associates
Mhm.
saying, "Well, we want to be able to say where the dollars go,"
Yeah.
So that's another thing I've been thinking a lot about is how do we do that, but also make sure that we are being consistent and that
Mhm.
we're staying in our guidelines and we're
Yeah.
staying, we're measuring the risk and we're doing all the things that we need to
Yep.
do,
Yeah.
but also, having our associates be involved in it in some way.
Yeah. Having those external voices that are
Mm,
investing in it, right?
yes.
It's a balance, right?
Yep.
The answer
Balance.
to everything, Jill.
Yes.
Balance.
Right. Yes.
All right. So, outside the foundation role, what does the landscape look like for eye health? What do you think has changed, over the last couple of years? And what do you think is going to change over the next like 5 years?
Yeah. Um, it's really interesting to see the AI coming
Mhm.
into play. And several years ago, when we would hear from organizations that were, kind of talking about telehealth and telemedicine and things like that. And before COVID, it was like, oh, lots of kind of concern and caution
Yeah.
around, is that effective? Is that the best, way to go? And then of course, since COVID, that has really, taken center stage, I think. And, it's so many more things are becoming digital and virtual and
Yeah.
all of that. So it's really interesting to watch the evolution of that because
Mhm.
I think, I'm not a healthcare professional, but I can certainly understand how that, the position that, healthcare professionals might be in of, yes, we want to adopt these systems, but
Yeah.
we want to make sure that we're also have a job, right? And I
Mhm.
think everybody feels that way about AI in a
Yeah.
way, but I think there's opportunity for us. I've learned more about it in the kind of just through the grant making lens and social
Yeah.
impact lens of it's an opportunity for us to decide how we want to use these tools
Yes.
and how we
Yes.
want to make them work for us, right?
Yes. Yeah.
We are in the position where we can determine is AI going to take over our lives, right? Or is it not? And we're just going to harness it and leverage it as a
Yeah.
tool. And I think that is the case across the board,
Yep.
but especially in healthcare and in eye care as well. And so I'm really interested to see where it goes. Of course, I think the rise of myopia and screen time, and we know that's already having a huge impact. So that I think is going to change things or continue to change things
Yep.
drastically. As far as I guess maybe almost like a sense of urgency behind,
Mhm.
this is why this is important. We have all these kids that are, now presenting with this and, we think we know what it is. So we need to get ahead of it. It will
Yep.
be an epidemic if it isn't already. So those are really, I think, the two things that interest me most are, yeah, the use of kind of the digital,
Mhm.
virtual platforms and ways of, getting screenings and even care in some
Yeah.
cases.
Yeah.
And how is that, how will that evolve in the future? What is that going to look like? And my hope is, that we're able to create it and craft it in a way that helps people get more and better care, right? And
Yep.
wherever that might be,
Yep.
whatever that might look like, let's ensure the quality is still there. Let's ensure these patients are still getting, the care that they need when they need it. And yeah, whatever tools we have that are being developed that where we can leverage that and do that, I think that's an awesome opportunity.
Me too. That is my hope is that together we are able to harness it so that we can start to maybe predict a little bit better in certain parts of the state where we know we could really like zero in on interventions and specific interventions and really change those outcomes and have immediate impact. I am excited to see how it plays out, a little bit anxious because I do think if it's not done with a lot of thought and a lot of intention, I think it could go the other direction very
Agreed.
quickly.
Yeah,
But my hope is, I mean, it certainly could be an incredible tool, I think, for on the prevention side, especially. We haven't really
absolutely.
had something like that before. And so that's my hope.
Agreed. Yeah. And I totally agree on that. The prevention, the awareness that,
Mhm.
there's so much there. And I think you're absolutely right. Thinking through methodically about what aspects of these tools can we use in what way?
Right.
Can there be a place for this and also, the things that we have in place and how can
Yeah.
we improve it? But yeah,
Mm.
I think that there's a lot of opportunity there. Maybe it's pre, actual visit to an eye care
Yeah.
professional or a post
Yes.
or what have you, but
Mhm.
definitely opportunity to leverage those tools.
Yeah, I agree. Okay, so we've talked through the foundation side, the eye health side. So, what would you again? What's your advice to people that are listening to learn more about eye health? What would you give them? Two pieces of advice to learn more about eye health.
Well, I have to say, visit Prevent Blindness Texas website, of course. Both Prevent Blindness Texas and the National, Prevent Blindness. You guys have amazing information on your site. There's also different associations. I know the American Academy of Ophthalmology and of Optometry. Those are great places to get resources and see, if you're a patient and you're seeking care that's close to you, you can find information there. And a lot of those organizations have really good programs as well for patients that maybe can't afford it, or if there's not an eye care professional near you. So those are some really good examples, I think. And then here locally in Fort Worth, I would love to mention Community Eye Clinic.
Yes.
It's one of the great partners that we support, as well as Northside Eye Clinic. So there's lots of great clinics here in Fort Worth as well. That do amazing work, and they provide services for anyone. They do not turn anybody away that comes in. So yeah, I guess those would be my recommendations. And I mean, I think also it's important to, anywhere that you're getting information, make sure that it is reputable, and there's so much stuff out there that you can Google and ask
Yeah.
chat GPT about and everything, so that always is my, my caveat is make sure they're reliable sources, which you guys absolutely are. We know this.
Yeah, we're all right. All right. Well, it has been awesome to talk to you. Um, Close out for us like with one more story about Alcon and your connection, or something that stands out for you just in the work over
Mhm.
the last decade that you've been able to do with Alcon.
Absolutely. Wow. Okay. Well, I have a few stories I could share here, but one of the things that stands out to me the most is in 2022, the Alcon Foundation was recognized as outstanding charitable entity, and that was by the Association of Fundraising Professionals in Fort Worth. And so um, we were able to go and have a nice meal and get an award. But the coolest thing for me was being in a room full of folks that I work with a lot. If you want to think about, I guess, sort of funding and fundraising as a coin, the fundraisers are on one side of the coin and the
Yeah.
funders are on the other side. And
Yeah.
so we partner together all the time and
Yeah.
talk and I get my information from, the
Mhm.
development people, right? They're the ones that are telling me everything about the organization and sometimes getting me, connected to the program people to learn more. But being able to be in that room and say thank you for them to the work that they do, because I cannot imagine how difficult it must be to hit the pavement every day, go try to raise funds. I'm not sure I could do that. I feel like that must be a very challenging role. And so being able to get up and thank them for the work that they do. I mean, yes, it was great for the foundation to be recognized, but I told Rhonda, I said, I owe this to you. The foundation owes this to you. You have, established so much with what we do through our work. And so she was like a proud mama, I think,
Mhm.
seeing us get that award. But it really was an honor just to be able to recognize the work of the folks with the nonprofits and, and how they just keep pushing every single day. And I will always admire that, I think, and I really do love that I'm in a position to try to be able to support those efforts, and be, kind of that supporter and that encourager along the way. So that was probably one of the proudest moments I think I've had.
That's awesome. That's a great example. That's a great example. Well, thank you so much for being part of our Eyespiring podcast today and for sharing your stories and your insight and your expertise and for just being a great partner.
Thank
Um,
you.
really, again, it's amazing to be in this space and do the work we do. But I will always say it is people. It is the people that make the difference across the board. And shout out to Rhonda. Rhonda's awesome
Yes.
too.
I know, I feel like I should have had a picture for the show, but
We should add a little Rhonda picture.
I know, yeah. But yeah,
Thank
I
you.
totally agree. It is. It's the people. I mean,
Yeah.
that's why we're in this work, right? We
Mhm.
are here to, in this case, help people, get their sight back or make it better, and impact their lives. So yeah, it really is all about the people. Agreed.
Thank you. And thank you
Thank
for
you.
being a part of PBT and pushing us to do better. So it's been awesome. All right. So in case you're wondering how you can get involved with PBT, we are always looking for volunteers. We do all different things. You can become a vision screener. So we do that training and certification. We are always looking for ambassadors to speak on our behalf and do education. Of course, you can always be a donor, but all different ways to engage and be part of the organization. So you can always go to our website and get more information about being a part of PBT. And for that, we are so glad you are here and listening to us. And if you haven't subscribed, please don't forget to. And we'll end with always thinking about what's your vision. Thanks. Have a great day.